And we welcome you back to our program here on Channel 6. Of course, each Thursday we get a chance to meet one of the fine folks that works for Kaiser Permanente right here in Orange County. And joining us today is Elena Esquivel. Elena is with the Senior Advantage Program for Kaiser right here in Orange County. Welcome to the program.
Thank you so much.
Good to have you with us today. Our topic today is Medicare, and we're hearing a lot about health care and Medicare right now. It's being discussed in Washington. The congressmen are having these town hall forums, and people are expressing some really strong feelings about health care and Medicare. I think a lot of our folks here that are obviously over 65 are well aware of what it's all about. But for maybe some of us who are not quite 65 yet, maybe you could explain what is Medicare, a little bit about the background of it.
Yes, thank you so much. Medicare is a federally funded program that was established in 1965, and it was signed on to the government system by President Lyndon B. Johnson.
Okay. And that's for seniors over age 65.
Yes.
And I understand it's not automatic, you have to sign up for it.
Right, that's correct. And the ways that you qualify for Medicare is if you've recently turned 65 and have worked 40 quarters or 10 years into the government system, and if you've currently been diagnosed with end-stage renal disease or on dialysis, or if you've been disabled for the past 2 years.
Okay, so some people that are on it may not quite be 65 yet, they may have some of these other medical conditions,
right,
which would qualify them as well. And then again, they need to sign up. Now, I understand there's multiple parts, kind of like the alphabet we learned in the first grade. So let's start off Part A of Medicare. I guess that's what the basic that everybody signs up for?
Yes, Part A is the hospital insurance, and you automatically get that once you have turned 65 or become eligible to Medicare. And that comes with no premium. You just automatically sign up for it when you've worked your 40 quarters. Okay,
and then there's Part B of Medicare, which was added a few years later.
Yes, Part B of Medicare is your medical insurance, and that does carry a premium of $96.40, and it covers all of your outpatient services such as doctor visits, specialists, labs and x-rays.
Okay, and then we've heard most recently about Part D of Medicare, the drug portion of Medicare.
Right, and the Part D is the prescription drug plan coverage, and it was established in 2006.
And there's, again, a charge for that.
Yes, there is. It does come with a monthly premium.
And there's a lot of complexities in the so-called donut hole, and
yes,
there's a lot more to it, a lot of things to learn about. Okay, we've done A, B, and D. What happened to Part C?
Part C is, we usually say it's the choice. Part C is a Medicare Advantage plan, and it's the way you choose to enroll your Medicare into a private health insurance. And one example is Kaiser Permanente Senior Advantage Program.
Okay. So that would be something that, I guess some people choose not to do that and pay everything out of pocket, what Medicare doesn't pay out of pocket, but for a lot of seniors, it's more cost effective to join a program such as the one that you have.
Yes, that's correct, because Kaiser Senior Advantage does offer the Part A, the Part B, the Part D, all integrated into one. We have our own hospitals, medical offices, and prescription drug plan, all incorporated into one plan. Right,
so if somebody chooses to use your Senior Advantage program, then they would get all these, plus the advantage of having your hospitals, your doctors, and it would all be in-house. You know, we hear so much today about people who basically doctor shop.
Yes.
And there's some celebrities, they go from doctor to doctor,
yes,
and Dr. A doesn't really know what Dr. B has prescribed.
Right.
By dealing with one entity like Kaiser, obviously there's a lot of safety there. You know, they're all gonna send you to the same pharmacy. They're all gonna kind of cross communicate with computers. So
right,
be a little safer that way.
Yes, it is. And you know, thank you for bringing that up. Is that with our Health Connect, we do have supercharged technology at Kaiser Permanente. When you come into one of our medical offices, you are instantly linked because we are interconnected with our computer system. You are instantly linked to your the doctors, the pharmacy, the laboratory. Every step of the way, they are instantly connected with you, and you're also able to connect yourself at home if you like the computer, or if maybe your son or daughter wants to find out information with you. You can email your doctor online, you can order prescriptions online, you can look up lab results online. That's something that's important to a lot of our members.
We're hearing a lot about the changes coming up in medical care. That's one thing I know they've stressed is more efficiency and more use of computers. Sounds like you folks are already into that mode. What if someone has gotten past 65? They can still sign up or not?
Yes, there are many ways to sign up right now during, we call this our special election period. And if you have Medicare, Medi-Cal, if you have recently turned 65 and you've just recently gotten Medicare Part A and Part B, if you've lost your employer group coverage, there are many ways to sign up right now during this time period before our annual election period. And I encourage you, for your listeners, to call us and find out. Call the number on your screen. line, leave a message, and we are, going to give you a call back. I am the local representative in the area, so
Good.
when in doubt, just give us a call.
All right, that's great, Elena. Well, we thank you for coming by today and sharing that information with us. And if you folks either are thinking about signing up for Medicare, about ready to sign up, or want to get more information about what Kaiser has to offer with their Senior Advantage program, give them a call, 932-2052. They'll get you connected with Elena, and she'll get you answers to all of your questions. Thank you so much for joining us today. Good to have you on the program.
Thank you so much. It was great being here.
Thank you. We'll be coming right back with more news and more guests as our Thursday program continues here on Channel 6 TV.